Shall we start?
Yes, ma'am.
Okay. So, addiction is there with us in generations. But as I told you earlier, maybe a century back or 2 centuries back, addiction was never an issue. It was a part of our social fabric. People used to consume drugs and they used to lead the normal life. We never used to see people on the roads or their families being disrupted, their work being disrupted, the person being disrupted. Never see that. But things have changed, and we see, yes, addiction is affecting people. Earlier in 1930s, it was thought that uh, people addicted to drugs were thought to be morally flawed and lacking willpower. So this was the concept. And those views shaped our society's response to drug use, treating it as a moral failing rather than a health problem. So people who used to consume alcohol, people used to smoke, people used to take opium, they felt that, okay, morally they are not good, they shouldn't be doing this, and they cannot stop because they don't have a willpower. But, and because of this, the whole issue was laced with stigma and discrimination. And intervention was not done by doctors or counselors. It was, they were being treated as either criminals, or they were taken to some baba or some temple or something like that, or they were left to themselves to take care of themselves. But came 1990s, and there were studies done of the brain with functional MRI, and we realized that people who are into addiction and independence, their brains are different functionally and structurally. And the new definition came: addiction is a chronic relapsing disorder characterized by compulsive drug using. See the word compulsive, and used despite adverse consequences and long term brain changes. And there is one more component to it, a behavioral component to it. So, from the concept of morality, from the concept of lack of willpower, from the concept of the person can control but he's still not controlling, we have come to a stage where we believe that there are brain changes, there are brain functional changes, there are brain structural changes, and there are changes in his behavior which leads to this change in whole person. And there are 5 C's of addiction. There is compulsion, the person is taking in spite of consequences, the use is chronic, and there is a loss of control, and there is a craving which he cannot help. So, the concept of disease of brain and not a fault of character. So, if you see the evolution of brain, earlier the reptiles had only the brain stem, that is a small part of brain over here. Then, as evolution happened, the midbrain came into picture. Midbrain, where there were emotions, where the reward, motivation, dominance, basic learning was there. In reptilian, it was just. Then, as the evolution progressed, the human being is the only animal in the world who has a forebrain. A forebrain where there is reasoning, self awareness, moral values, and planning. Right? So, we say that addiction is a circuit problem and a chemical
Just a
locha
moment,
that's
ma'am.
going on.
Just a
The
moment, ma'am.
midbrain, we need to understand,
Dear
is a
Xiaomi.
part of the brain
Dear Xiaomi
which
221111.
does not think. It works on impulse. It's hardwired just to do things which are good for survival. So
Excuse
it is
me,
based on reward and
please.
motivation. Whatever gives
I
us
cannot
pleasure,
hear.
do it now. It
Please
drives us
mute.
to seek rewards and avoid pain. Basic survival responses. So when there is a danger, the midbrain gets into action. So we know that ventral tegmental area, substantia nigra, all these are part of the midbrain. But, and this
ठाण्यात होते, पण माझं जे सगळं आहे ते तिथं येतं.
Excuse me.
Excuse me. Please mute yourself. Somebody on the phone. Yes, ma'am. Please continue.
Yeah. Okay. So this is the midbrain. You need to understand the midbrain because addiction starts over here, and this part of the brain is something that driving the whole addiction issue. Because what addiction does is that it doesn't allow the forebrain, the part of the brain that is a thinking brain, to work. This is the forebrain. This is the part of the brain which only human being has. And the forebrain is supposed to think. It think about moral values, think about priorities, what is good for me in long term and not just short term pleasure. It helps us to plan, it helps to make decisions based on our morality and values and priorities. So all these things are done by the forebrain. And what happens in addiction is that this part of the brain is hijacked, and the person works only on the midbrain section, only on the impulse, only something to avoid pain and just to have the normal pleasure first and then afterwards to avoid pain. So why this happen? So we know that forebrain specialty is human, it's like a break. Forebrain tells us to pause, to evaluate, weigh things, pros and cons, and decide about morality, values, and priorities. Long-term goals is something more important than short-term pleasure. But the midbrain tells us survival. Just now I want something and I'll use it, either to get pleasure or to avoid pain. So this is a normal reward pathway in the midbrain that we see. We have nucleus accumbens, Na, tegmental VTA. So all this is activated even in our natural behavior. So when you feel hungry and you eat, this part of the brain is activated, dopamine is released. When you feel thirsty and you drink water, dopamine is released. When you meet a friend, you feel good, again dopamine is released. When you have sex, you feel good, dopamine is released. When you get an award, you feel good, dopamine is released. So there is nothing wrong in the midbrain. This part of the brain is made us to survive, made us to thrive, made us to made to feel us good. But what happens is that this natural rewards that we get with food and sex, the dopamine level is not more than 200 if you see the units. But when it comes to drugs, the dopamine goes to 1000, dopamine goes to 400, dopamine goes to 250 or so. And that's the problem. Because the dopamine level goes much higher than the natural things that happen in our life. The natural pleasures of a life is eating, drinking, having sex, meeting friends, achieving something, exercising. All these activities, in all these activities, the dopamine is never beyond 200. But the drugs, the dopamine is always beyond 200. And that's the problem. And that's the problem because the person who is used to such a high dopamine, when the drug is not there, the dopamine doesn't just remain up to 200, it goes below 200. And because of that, if the person has food, has sex, he doesn't feel good. These normal things in life doesn't matter to him now. What he is looking for is the drug of choice. So there is a reward deficiency syndrome. That means if the person is addicted, dependent, the normal things in his life, his relationships, sex, food, drink, friends, exercise, achievements, they don't matter anymore. What matters is the drug. Drugs are addictive because the brain regions are usually more effectively and for a longer period the dopamine is released than the natural rewards. And that's why they are addictive. because dopamine is there for a very long time and they are released in a very large number. And then comes a stage when the willpower fails. We know that the frontal cortex of our brain is a brake of our brain, and the the midbrain is somewhere which just tells accelerator, I'll go. The brain tells you, the frontal cortex tell you stop, you cannot go, you cannot take more than 2 drinks. But in an addicted brain, the prefrontal cortex is hijacked. It doesn't work. It actually shrinks and the brake is not working. And the reward system, that is the midbrain, the accelerator is overactive. And that's the reason the person continues using in spite of the knowledge that the drug is or the alcohol is causing harm in his life, in his society. So when we say the person, why doesn't he stop in spite of everything? There is an explanation that happens in the brain. The prefrontal cortex, the brake system is failing. And that's the reason the person cannot stop. And the tolerance develop. That means the person who was happy and high with using 2 pegs a day, the dopamine now is not happy. The brain is not happy with 2 pegs. The dopamine release decreases, or the receptors decrease, or they become less sensitive. So the 2 pegs don't give that feeling that he used to get. So now he goes to 4 peg, then he goes to 8 peg. So the amount goes on increasing, and in spite of everything, a stage comes that even if he takes maximum amount, he still doesn't feel high. Nothing feels more enjoyable, anything except using the substance. And even the substance doesn't give him that high when he comes to a stage of withdrawal. That means the dopamine goes so low, the person has symptoms. Stress hormones are released, and brain goes in a hyperactive mode. And for this, because of this, they have symptoms of anxiety, irritability, restlessness, insomnia, severe craving, severe physical symptoms that they have. So we see alcohol withdrawals, we see opium withdrawals, we see nicotine, smoking se jo withdrawals hote hai, psychological withdrawals that we see. So now comes a stage where the person is not taking because he feels good. The person has to take because he cannot do without it. If he just do without it, he gets withdrawal symptoms. So even if we look at the triggers are there. So the people, the places, the smells, the emotions, the stress, all triggers are there. The moment he gets the trigger, he gets the craving. And the moment he gets the craving, he goes into relapse. So withdrawal, craving, and relapse. All this happens in the brain with the stress circuit, in the amygdala, where there is a emotion stored over there. So all this leads to the brain changes, and we see the 3 stages of addiction. The first stage of binge intoxication, where the person takes because he feels good. Now comes the second stage, or the withdrawal or the negative effect stage, where the person takes to avoid the bad feeling. And then comes the preoccupation or the obsession stage, where the craving triggered by stress, people, places, and emotions and memories becomes so strong that he just can't stop. He takes again, and the cycle goes on. And this cycle can continue for months and years till the person either takes help or something happens to him and he suddenly comes out of it. We have seen this quantum changes also. So these are the stages of addiction. And as I told you, that a stage comes when after the withdrawal, the person is not happy. The dopamine level goes below the normal happiness level. So we see many patients who come to us that ड्रिंक्स नाही घेतली किंवा स्मोक नाही केले किंवा ड्रग्स नाही घेतले तर आय फील व्हेरी डिप्रेस्ड, आय फील एन्शियस, I don't feel like normal as I used to feel earlier. And this can go on for a very long time, even after stopping drugs, right? So from an impulse control disorder, it becomes a compulsive disorder as the person progresses from intoxication to a dependent stage. And unfortunately, this addictive substance hijack our survival system, our motivation, our decision making, our risk and reward assessment, our pleasure seeking, our impulse control, our emotions, our memory, our stress control, and our learning. All these important features of who we are as human being, that is being hijacked by the drug use. And that's the reason, in spite of we say that no means no is not possible, brain addiction affects the same brain circuits involved in reward, motivation, memory, and inhibitory control. Person loses capacity to freely choose not to use drugs, even when it means losing everything they used to value. So that's the problem. And that's why we say if the person is dependent and deep into addiction, he is driving a car without a brake. It's no more a choice to say stop. And we see many patients coming to us, wives complain कि इनको कितनी बार बोला है कि बंद कर दो, ये बोलते हैं कि नहीं आज मेरा लास्ट ड्रिंक है, मैं कल से नहीं लूंगा, पर कल से वही शुरू हो जाता है. So actually, what the wife is trying to do, she's trying him to apply the brake, telling him to you apply your brakes. But unfortunately, if he has gone into stage of addiction where his brain is have been involved by addiction or dependence, it is not possible for him to say no without help. He would need help. He would need medications. He would need counseling. He would need family support to come out of it. He would need a new way of life where there is no drug. And that's the reason we say that addiction is a disease of brain with behavioral modification, and it's a chronic disease with relapses possible. And that's the reason we need to treat it. It's a disease to be treated. Now we have seen that all these neurotransmitter, hormones, the synapses, parts of the brain involved. But does the brain change structurally also, not just functionally? Yes. There are MRIs done where we have seen that the brain actually looks different in a person who uses drugs for a very long time as against to the person who doesn't use drugs. So we see that in a healthy brain, the forebrain, that is the prefrontal cortex or the forebrain, is lightening more. That means the glucose is going more over there. That is, it's more active. As against a person who is using drug for a very long time, you don't see any lightening in the prefrontal cortex. That means that part of the brain which thinks, the brain which says that no, stop, the brain which say this is not right, morally right, or not right for my situation, that part of the brain is not working. And that's the reason we see that the brain is distinctly different biologically. Receptor function is different, metabolic activity is different, responsiveness to environmental clue is different, and gene expression is different. So brain is not affected just functionally but also structurally. And what happens if this addiction is started at a younger age, a age less than 21? Why we say that we have to catch our children young before they go into, because our brain is under development up to the age of 25. It is not fully developed till the age of 25. If you see, this yellow is undeveloped brain and this blue is fully developed brain. The last part of the brain to be developed is the prefrontal cortex. That means the decision making, the thinking brain is the last one to develop. And that's the reason we see that why children, teenage children, are so impulsive, why they are prone to taking risk, why they don't think before acting, why they don't listen to their parents. Because the part of the brain which makes you think, executive functions and thinking function, is not yet developed till their brain is between 21 and 25 years of age. And that's why we say that a child who starts drug before the age of 15 has almost 30% of the chance of going into dependence or so-called substance use disorder in their life future, as against 4% if they stop themselves at the age of 21. So our aim should be, of course, no drug use ever, but if possible, at least not till the age of 21. If we can delay that first exposure of alcohol, smoking, or drugs till the age of 21, we can prevent almost 30% addictions in our society, because we know that children themselves already have mental disorders starting in the teen age. All this in the lower uh, uh, X thing, we have the age, and here the diseases. So we know that anxiety disorders, mood disorders, schizophrenia, impulse control disorders, all this happens below the age of 30. It starts below the age of 30. And in that, if there is addiction, then you have two disorders together: anxiety plus drugs, mood plus drugs, schizophrenia plus drugs, impulse controls plus drugs. So, two disorders going on if they start before the age of 21. We know all these mental illnesses, they come before the age of 25. Then again, today, children, especially in their teenage, have a lot of pressure, and their brain is not developed to take so much of pressure. There is academic pressure, there is body image pressure. Children look at the Instagram and they want to look the best because everyone is posting the best photos. So there is self-esteem issue, there is peer acceptance problem, career choices to be made at the age of 18 after 12, and the brain is not developed to make those choices actually. Then all the first love crashes, breakups happen in this age, and they want to try something new because the brain is risk taking, in the stage where the brain knows that it has to take risk. And all these things happen in a brain which is not actually prepared for it. Because the brain is not prepared, the forebrain is not there, the problem solving is not that good, the decision making, judgment, emotional regulation, frustration tolerance, very important, is not developed. Conceptual thinking is something low, they have an impulse control problem. So young brains are designed to seek rewards and be impulsive, and here comes a drug in an impulsive brain, and it creates havoc. So then such a brain has a genetic background to it. So if such a child has father or uncle or nana, nani, dada, someone using drugs, so he has a genetic background, he has a environmental things, the chances that he going into addiction increases a lot fold. Then we know that addiction happens in the brain and the brain is changed. But the good news is that brain is a neuroplastic organ. It can change from good to bad, bad to good. What it requires is consistent environmental changes, consistently remaining away from the substance of use. So as brain changes because of addiction, the brain can change in recovery. It will take maybe year, 2 years, 3 years, 4 years. So as our speaker said, that I am in recovery. Even after 10 years and 12 years and 15 years, they say we are in recovery. They don't say we are cured of addiction. They say we are in recovery of addiction. So we know that we can actually help people recover from the addiction if we consistently do follow the uh, counseling, medications, plus the replacement therapy and the behavioral changes in the person, the relapse prevention thing. And there is something called brain derived neurotropic factor, BDNF. And that factor, that molecule, helps in neural survival, growth, brain plasticity, learning, and memory. And from where do we get this BDNF? Is it something that we get from outside? No. You can naturally increase your BDNF. You can advise your patients in recovery to regularly exercise, especially aerobic. Challenge your brain with learning, reading, and mentally different tasks. Eat a healthy diet rich in plant foods. Include polyphenols, that is, rich food like fruits, vegetables, and teas. Omega 3 fatty acids. Sleeping well. reducing stress, chronic stress, limit highly processed foods and excess alcohol, stay physically active and mentally engaged. So we advise them to use puzzle games or solve the jigsaw games or solve the word games, and spend time with supportive people, make connection, make strong friendships, emotional support and positive relationships. All these things, if the person does in the process of recovery, their brain BDNF increases naturally in the brain, and if the BDNF increases, the chances of recovery increases. So that is all we have to work with our patients when the person is in recovery. And one last thing that I would like to tell you is that as addiction is, as love is blind, so is addiction. We have seen changes in the brain when the person falls in love, and these changes are exactly the way we see when the person falls in addiction. So if we can accept love in a life, we should accept that a person in addiction is also going through that. And when you tell him or her that you have to stop, for him it's a breakup, and in that breakup the person needs help from you, help from his society, help from his family, help from his treating doctor, everyone. Thank you. So this was about the brain neurology. Leon, are you there?
Yes, ma'am.
Yeah.
I'm there.
Just help. Leon is a close friend of ours. He works in a rehab in Mumbai. He had been part of our lectures in the last year lecture series, and he's there to share his journey with us. After his sharing, I would like to share with you all that this lecture series not just coming and attending lectures. There will be a lot of work that will be given that has to be done at home, a lot of activities to be given. So be active on the WhatsApp. Please do the activities I suggest, because we are not here to take a certificate. We are here to change ourselves and our attitudes towards an issue that's affecting our society. So let's form a group of people who together want to make a difference. And people who have joined today's lectures but have not registered for the series, and if they are interested, just let me know. Today's PPTs I'll be sharing with all of you, and I'll be sharing this recording also if it turns out good. I'll be sharing the recording also. Okay, Leon, waiting for your sharing. And thank you so much, Leon, for coming for sharing. Over to you.
Thanks, Dr. Madhu. I'm indeed, I was very pleased with the presentation today. There was a lot of insight and a lot of, knowledge imparted from you to us today regarding how the brain functions. Okay, though I've attended a lot of sessions from you and various other facilitators, uh, I hope to learn quite a few more things. Okay, and it was a good brush up as well. And today I would like to share my journey in recovery and in addiction. I'll make it as short as possible because we are running out of time as well. And try to wrap it up in around 10 to 12, 13 minutes. Okay, because my journey in addiction and recovery, it's a long, long story. By the way, I forgot to tell all the participants about myself. I work as a therapist, okay, and I have roughly around, you can say, 12 to 13 years of practical experience in the field of counseling. And, I have my own experience as well as a recovering alcoholic. I've been to addiction from quite an early age, like Dr. Madhu just said. Addiction starts at a very early age. So I just went back, and I can also say that my addiction to alcohol started in the year 1978 when I was in school. Okay, I'm a Mumbai girl, okay, and I come from a Catholic family. And as you all know, Catholic families, alcohol is allowed. It's a normal thing. Whether it's a birthday, whether somebody died, whether somebody is born, be it a wedding, be it a reception, engagement, whatever be the occasion, alcohol is always there. Okay, so right from an early age in 1978, when I was in school, during my school vacations, I used to go to my uncle's places, in Mumbai. And there, every Sunday they used to have parties, and every Sunday I was given a glass of beer to drink, saying that, this is good for your stomach. We have this, you'll have good health, your stomach will function well, everything, and all that stuff. So I used to have it, and I used to like the effect produced by the having that one glass of beer. I used to. There's the behavior change as well after having that one glass of beer. I like to be the company. I felt like more matured. I felt like more matured. I was in the company of elders. Okay, I was in the company of elders.
Excuse me, Bharti, please mute yourself. We cannot hear. Bharti.
There's some disturbance behind.
There is some Bharti. Please mute.
The host also can mute everyone.
Yeah, I'll do it actually. Yeah. Yeah.
Yeah, thank you so much, ma'am. And so as I said, I used to like the effect produced by that one glass of beer. Then I used to keep waiting, as to when I can get the next opportunity to go to my uncle's place, because there was a lot of fun having the one glass of beer. Then dancing to music. Those days ABBA, Boney M were very familiar. I'm talking about 1978. I was in my eighth standard, and slowly, my behavior started changing. I became more free. As it is, I'm a very outgoing person. I love to mingle around, socially, interact with people. So for me, it became like it's part of my daily structure. And after completing my 10th standard, I studied in a very good school in Chambur, Our Lady of Perpetual Saka High School. That's one of the best schools I can say. And I passed out in the year 1980 doing my SSC, and then I joined a college. And there in college, my actual drinking progressed. Okay, and it was like occasionally uh, like a beer. Then it started like every month, and it progressed to a level where every weekend I used to have a beer. And I think by the time 1989, I went abroad to work. And by that, today when I take an inventory, I can remember that when I went abroad in the year 1989, I was already an alcoholic man. Okay, it took me
Oh,
years to figure this out, and because my behavior changed, I was getting very violent, and my way of talking, behaving with my family, I was very arrogant, very rude. I used to come home late, and often having fights, drinking outside, absconding from home for 4 days, going out with friends. Okay. And in the year 89, I went abroad. And the first country that I went abroad was Saudi Arabia, the Kingdom of Saudi Arabia. In the year 1981, 89, when things were very strange. But there too, I had friends who were consuming alcohol at that time in the year 1989, though in Saudi Arabia, drinking, drugs, everything was banned, prohibited. But we used to get that locally made stuff, and then my drinking progressed to a greater extent. Okay, so all these things happened around 23 years of my drinking. A majority of my drinking was done abroad in all the Middle East countries. I traveled to all the Middle East countries. I worked in the best of companies. But in the end, what happened was there were multiple job losses. And each time, because of my drinking, I had to put down my papers and come down to India. And then I got married. And in the year 2000, after I got married, uh, by that time, my drinking had already reached the next level. Okay. And there was a particular time in a day when I needed a drink. Okay, वो घंटी बजती थी मेरी शाम को 7 बजे तो मेरी घंटी बजता है so automatically go to the bar and drink. And as my drinking progressed, my problems also increased. There was loss of health. There was loss of emotional well-being was also gone. There was loss of trust. The relationships were damaged, and employment, career, financial things, financial status, everything started getting damaged. I had lost my self-respect. Losing out on time as well, and I could see all my dreams and goals. I was a very good player in the industry that I worked in. I was in the beverage industry, and I was a very good performer. But because of my alcoholism, slowly my work performance decreased. My respect was lost, and I had to every time I had to leave my job and come. And after I got married, things started getting worse, and a time came when it was compulsive drinking. From what started as experimentation, it went on to regular use. From regular use, it went on to, you can see, risky use. Okay, visiting high risk places under the influence of alcohol, and finally the day came when it was compulsive drinking. Now the time came. It was such that I needed a drink to survive, to breathe. Okay, the morning when I used to wake up, my waking thoughts were all related to my alcohol, and that was my rock bottom scenario. In the end, for because of alcohol, I lost out on everything, everything. I lost my family. I was madly in love. So I'm like, it was so compulsive, and I used to dislike it when anybody used to say anything about my drinking and violence, aggressive behavior. Then, because of my alcoholism, I left my family. I chose the bottle over the family, man. That was the scenario in the end. And finally, I was out on the streets. Okay. It was a rock bottom case, man. Totally rock bottom. I had my entire family in Mumbai, but I was on the streets. Okay. And I was also so stubborn, so stubborn. See, I had hit rock bottom, but still my ego, my false pride did not allow me to say sorry, did not allow me to make amends. Because, I never gave in. But finally, as God works in his own mysterious ways, you can say, I managed to get into a rehabilitation center. But there was a transit. I was in the jail for an offense. From the jail, I landed in Holy Spirit Hospital for a detox. From the Holy Spirit Hospital, after the detox of say around 10 days, I was straight away taken to Kripa Foundation in Bandra. And from Kripa Foundation, I was taken to Bardawadi for a detox. And then again back to Bandra for the rehabilitation for the entire course. And those days, the treatment period was for a period of 3 months. Max extended for another month, you can say extended care. But willingly stayed there for 3 years. This was
Oh,
when my mentor gave me an opportunity to stay there. I grabbed it because I did not have a roof over my head now. That was my stay. And no roof over the head, no support at all. So this was like a God-sent opportunity. I stayed for 3 years in Kripa. As a voluntary, then it's a, like it was kind of a charity work, you can say. But during that 3 years period, since I was very good in grasping a lot of things, I managed to do a lot of studies. I did courses at Muktangan. I did courses with RRTC. Okay. And then I moved out from there after a period of 3 years. Then again, I started my life afresh. I went back abroad. Okay. And then I
Oh,
came down in the year, sorry, in the year 2016. And 2016, when I came back, now see, in the span of 14 years after I came out from Kripa, and then I went abroad. Uh, in this 3 years, none of my family members, came to visit me. Okay, so things were not that. I mean, it was very difficult for me because when I used to see everyone's family coming and visiting them, and I was the one who was arranging for all the family meetings. But anyway, it was like, for me, it was like surrender. I question myself as there was a lot of inventory done by me and a lot of self-reflection questions. Kripa gave me a lot of insight as to what to do, what not to do. And over a period of time, I interacted with a lot of inmates from there. I had very good counselors in Kripa. I still, my deepest gratitude to them because had we not been there, this change would have not been possible. So thanks to a million thanks to my counselor. They showed a lot of empathy. There was a lot of, the basic ethics required in counseling, empathy, congruence, unconditional positive regard. Everything was a rapport building. Everything was done. And slowly and steadily, things started moving. Now I'm 24 years into recovery. Okay. I'm a recovering alcoholic. This September 8th, I'll be completing 24 years of my sobriety. I'm an active member of a 12-step program. Okay, I attend meetings and I do whatever it takes to stay sober today. For me, the program works just 24 hours, one day at a time. And my interaction, I'm associated with around three centers in Mumbai. And during this work of mine, I interact with a lot of clients, a lot of patients. Okay, different addictions like drugs, alcohol, behavioral addictions, and interacting with them. And I learn a lot from them as well. And I, give them what has been given to me. Okay, I pass it on to them. I have unconditional positive regard for them. I listen patiently, and these are all the qualities that in this so many years of my sobriety and so many years of my training with personalities like you, Asira ma'am, Dr. Anuradha, and Dr. Rajendra, and with all these institutions, has worked out. 17 years, I reconciled with my wife after 14 years,
Wow.
and today I'm very grateful to her, to my family. I'm sharing a very good relationship with my family, with my siblings. My mom, who was once scared of my drinking, she spent her last days with me when I was sober. So really thank God for giving me that opportunity as well. And overall, right now, I'm living life one day at a time as per the program says. I take a daily inventory of myself. Because I follow the discipline given to me, the instructions which were given to me when I was in Kripa. I still follow the same routine. I wake up at 4:30. I sleep at 10:30. I still practice yoga, do my exercise, meditation. So, like a combination of all the things that I've learned from different people and from my patients. And it's like one day I'm full. Life is good, ma'am, without alcohol. And I can only say that if there is a will, there is a way. The only thing is, I have to ask for help. Okay, as a counselor also, I still have faced problems. I still encounter a lot of obstacles in my daily life. But thanks to God, I have the techniques, coping skills, and I have people who are willing and ready to help me at any time. Okay, so this is my journey. And as I said, addiction is it's a killer disease. It's a threefold disease: physical, mental, and spiritual. And at the same time, it's a family disease as well because एक आदमी पीता है तो घर का 7-8 आदमी बीमार पड़ जाता है. Okay, the entire family gets sick. The entire family gets neurotic. But the alcoholic, he just drinks and he falls down in a corner. He goes into blackouts. I know what it's like because I was not into a chronic stage. I was in a severe stage, ma'am. Had I
Yeah.
not been admitted in Kripa Foundation on the 8th of September 2002, I would not have seen 2003. That was for sure. Somewhere God worked his way out with me. And I was lucky to find good people in my life, people who helped me, and that is what I am passing it on. I'm passing on what I've got to others. So as you said, we as a team, we need to bring a change in the society. There's a lot of stigma attached to addiction when it comes to today. Just before joining the session, I was on a one-to-one with a inmate, and he was around 24 years old. He's a boy, and this is the ninth time he's attempting a rehabilitation program. And he was sharing his experience, his stories with me. I was literally dumbfounded, ma'am. It was like, I had tears in my eyes. The kind of, like the trauma that he has gone through in some of the centers. Okay. And it's because of the trauma, multiple relapses. And each time if the relapse occurs, there is more damage and family damage, relationships are damaged, the trust factor is gone. It's a lifelong process, ma'am. As you know, there's the physical allergy, the mental obsession. Once I start, I cannot stop. That is it. Because I'm an alcoholic, I'm not a social drinker, I'm not an occasional drinker. But so for me, what has happened is my practical knowledge as a recovering alcoholic plus my theoretical knowledge has given me, a lot of exposure. And I
Yeah.
can deal with my clients in a very fulfilling way. Okay. And the clients, I really enjoy with my clients, with my patients. It's not the money factor that I'm looking at, but it's the satisfaction that I get by helping them out. I'm 63 years old, and it's just one day at a time, ma'am. Thank you so much because you also been a great
Amazing.
help. Your words are so inspiring. Okay. Once again, thank you, ma'am. And during this course, I'll be sharing. If I get the opportunity, I'll keep sharing my experiences with you all,
Sure.
on
Sure.
and off.
Thank you so much. Leon, you
Okay,
are
ma'am.
an inspiration for us.
No problem, ma'am.
And this your story gets
Thank you so
every
much.
time I hear your story, I get tears in my eyes. Believe me.
Thank you, ma'am. Thank you.
Thank you.
I'm obliged. Yeah.
I think every one of us should thank Leon for sharing his journey with us. It shows what we are dealing with when it comes to addiction. What's going on in the person who is sitting in front of us, what's going on in his mind, what's going on in his life, what's going on in his family.
Exactly, ma'am.
Unless you understand that, I don't think you'll be able to help anyone. Writing a prescription is just 1% of your job.
But it's more than that, ma'am. It's the unconditional positive regard that you have for the
Yes,
patient,
yes,
the rapport that you build, the trust factor, the confidentiality.
yes.
Okay, that is more
Yeah,
important. Okay,
yeah.
so that helps a lot. And I like the last time I did the post with you of motivational interviewing. I'm applying
Techniques.
all those techniques as well. I apply CBT, REBT, ACT, DBT. I apply all the techniques.
Wow.
But
Great.
yours, motivational interviewing is
Thank
one
you.
of the best
Thank,
where addiction is concerned.
thank you. Thank you. We'll be
Thank you,
going through
ma'am.
it once more. Yeah. Thank you. Thank you, Leon. Thank you.
You're
Okay.
most welcome. You're most welcome.
Yeah. Thank you. So goodbye to everyone. We'll be joining on Friday, 3 p.m. Um, Before that, I'll be sharing the recording. What I'll do is at night, I'll sit and try the whole lecture again and try to record that. If I can do that, I'll share that fresh recording so that it won't have all these glitches. Okay. Uh, so those who have not joined for the addiction course, and if you feel that you should be joining, please send me a hi on WhatsApp. I'll send you the link and you can join. Those who have joined for the learning only program and you feel that you should get the PPTs and all the homework and assessments that we do. So it would be hand holding for everyone. So if you want to join the complete learning course, just let me know. I'll help you in that also. So thank you everyone. See you. Bye.